I am verifying my provider's orders and care plan, and I am going to be following standard precautions throughout this procedure. I'm going to knock on the door, and I'm going to go to my patient, and I'm going to say, "Hi, I'm Jania from Nevada State College. I'm a student nurse, and I'm here with Rachel, my professor Rachel, and I'm going to, I have gathered my supplies. I'm going to clean my hands. Of course, I have provided privacy. Cleaning my hands, okay? And I'm going to identify my patient right away. I'm going to say hello. How are you doing? And if the patient can speak, then they'll tell me how they're doing. And I'm going to look at their wristband, and I'm going to verify who they are. Ask your first name and the last name, birth date, and do you have any allergies? Okay, no. So they do not. So what I'm going to do is I'm going to raise the bed to a comfortable working position, and I'm going to go ahead and start talking to my patient about what the procedure is. So, is it okay if I pull up a chair? Okay, great. All right, so I'm pulling up a chair. I've asked my patient how they're doing. I've checked their identity, and I am going to be now raising the bed. The bed is going to go up. The bed's going to go up 30 to 45 degrees, which is semi-Fowler's position, okay? So then I'm going to go ahead and don some gloves, and I'm going to talk to the patient and say, you know, I'm here today because you have the tracheostomy, and we need to perform trach care, which is going to be to remove the secretions that have accumulated, and also I will be, in part 2, I will be cleaning the cannula, okay? So the reason why we want to do this is because we want my patient to be able to breathe better and be more comfortable. Okay, so now that the bed is raised and I've put on my gloves, okay, I'm going to be starting with my vital signs. Okay, so what's important about vital signs, especially for this, is that I will be doing it twice. Okay, so I will perform my vital signs with my normal vital signs, but the most important thing is to get the pulse oximeter because I want to make sure that my patient has enough oxygen. Okay, so what I would do is then I have done all that assessment. I have done my vitals. I will look at my patient and I will make sure the stoma is, there's no skin breakdown and the skin integrity looks good. So I have assessed that and I have touched the patient. So I would be taking off my gloves. I am going to turn on my oxygen and I'm going to dispose of my gloves, hand hygiene. Turned on the oxygen, and I've also turned on my suction. Okay, so for the oxygen, I need my patient to be hyperoxygenated. So in other words, I can have an ambu bag here to do some extra oxygen, or I can ask my patient if he can or she can to take 3 to 5 deep breaths, which will help get the oxygen there. Okay, I've turned on my suction, and it is between 80 and 120, okay? So what I'm going to be doing now is I'm going to be donning my gloves, okay? So hand hygiene, always. And this is my kit. I brought in, actually, I would have 2 because I would like to have the cannula, I would have 2. One is the size that my patient is, and then one that's smaller. In case the stoma does close, there's something that goes wrong, we want to make sure we can get that back in. And I've always taken 2 pairs of gloves as well. I could have extra sterile gloves, okay? So what I'm going to do is I'm going to open this is sterile, I'm going to open this. Careful not to touch anything inside, okay? It comes with a gauze, which it came with, so just so you know, I haven't touched that. And I'm going to open my sterile gloves. And don my sterile gloves. Now before I don my sterile gloves, I perform hand hygiene, not just putting on you know, hand sanitizer or anything like that. I would be scrubbing with some good friction, okay? Okay, so I'm gonna go ahead and do my dominant hand first, keeping my thumb in, not to touch anything. Okay, cupping this hand as well. Now, I didn't do a great job here, but that's okay. Did this come with the right amount of digits? Sometimes things like this happen. You have to be very careful. Sterile gloves, okay? So I could just get rid of this. I've had my sterile gloves. Now this is sterile. My patient is ready. I've already explained what's going on. I've set my oxygen. My patient has taken 3 to 5 deep, good breaths, okay? And now the next thing that I'm gonna do is I'm going to maintain my sterile field, but I'm gonna pick up my suction. I will be connecting it with this hand, okay? Okay. And then this is the part that's gonna go into the patient, okay? So I'm gonna be putting this inside the patient, and I'm gonna be making sure with my dominant hand that I go in 13 centimeters at the very most. I don't wanna go beyond that because then I will hit the carina, and I will make sure that when I do this, I do not go more than 10 to 15 seconds because we don't want our patient to start choking or be less oxygenated, okay? So I've gone in, okay, no more than 13, and I've done a little bit of circling so I can get all the secretions out. And so now I've taken that out, and I'm going to wrap up the cord here, put it in my hand, and I'm going to remove what would be the gauze that is soiled on my patient. So pretend this is the gauze that I've moved, okay? So now I will be taking these things off, wrapping them up, and disposing. I will go ahead and do hand hygiene again. I'm gonna ask my patient, how are you doing? The patient says the patient's doing fine, okay? And now I've performed my hand hygiene, and the next thing I'm gonna do is go ahead and lower my bed. If the patient wants to lay back down, he can, but I'm gonna raise my rails, and I'm gonna provide the call light for my patient, and I'm gonna say, I'm gonna be back whenever if you need to call me on your call light, go ahead and return. But I will be making my rounds within an hour, okay? So that completes the first half of my video, and I'm gonna do another half.